Hello and good evening, everybody. I am Anuja Purohit from Prostate Wellness Team. I am sure all of you must be keeping good health. Today, we are going to discuss a very important topic, and that is male infertility. Male infertility is a medical condition where a man has difficulty helping his partner conceive a child. It's a more common issue than many people realize, affecting approximately 7% of men worldwide. Infertility is typically defined as the inability to achieve pregnancy after 1 year of regular unprotected sexual intercourse. Male infertility affects approximately 10 to 15% of men in India. This implies that for every 100 couples attempting to conceive, 10 to 15 will encounter challenges related to male infertility. And of all the infertility cases, 40 to 50% are accounted towards male infertility. To throw more light on the subject and guide us on what's right for the diagnosis as well as treatment of male infertility, today we have with us renowned urologist Dr. B. Krishna Mohan. Welcome, sir.
Yeah. Hi. Hi. So I'm Dr. Krishna Mohan, consultant urologist, andrologist, and men's health specialist from Coimbatore. So today we are going to just speak about a very important topic, as already they have explained. So male infertility is on the rise. It's been because of these lifestyle changes that we are having. So it is on a constant rise all over India. So male infertility has become so common that 1 in 10 couples the men do have some degree of infertility that they are facing. So why is this so important? So because the infertility it has a varied range from say if you are it is a newly married couple, they can have infertility, or if they are trying for a second child, at that time they can have infertility. So male infertility can be primary. So primary meaning the first child, they are not able to have the first child itself, or it can be secondary, which is can be after maybe after the first child they are not able to conceive the second child. So another classification is so it can be due to various reasons. One can be due to the low amount of sperm count, or it can be some issue in having sexual intercourse, or they are not able to push out the sperm. So male infertility generally it is more common in people who have a sedentary life, or they have uh, other issue, what addictions like smoking, drinking, and other like drug use and other issues. So generally, male infertility affects the people with, as I've told you, we in India are slowly turning into a westernized society. So the lifestyle, we have become more sedentary. We are putting on a lot of weight. Obesity is on the rise, and a lot of metabolic syndromes, diabetes, hypertension in young age. So similarly, this is also affecting our fertility. So, fertility, so we'll broadly divide into male infertility. Primarily, what issues we face commonly is low sperm count. So, the sperms are the cells that are required to form a baby. So, from the male side, and from the female side, it is the ovum or the egg. So, when the sperm is very less in the male semen, so the formation of the baby will be difficult. So the sperm count ranges from very low, severe, we say it as oligospermia, when there's very less amount of sperm in the semen, or it can be mild to moderate as well, or sometimes.
How much sperm count is considered normal?
So sperm count generally about 15 million. Above 15 million is sufficient for forming a baby. So, but the problem is sometimes the only the count and all we cannot concentrate only on the count. Sometimes there can be abnormalities in the quality of the semen. So there can be a lot of sperms, but none of the sperms might be normal. Like they might not be motile. So motile meaning these sperms have to move in the female tract to reach the egg in order to fertilize the egg to form a baby or an embryo. So when the sperm are not in good quality, meaning that they are not traveling properly, they are not motile properly, or they are having some amount of morphological defects, or the nucleus within them is not abnormal, at those times also we do face issues in fertility. So broadly, we would say oligospermia, which is less than 15 million. Sometimes what happens is in severe infertility, there might not be zero sperms. There will be zero sperms in the semen. At that time, it is a very problematic issue. Here, they might require surgical extraction of sperms from the testis. So
Can
this
birth
would
defect play any role in this? The
no the
developmental
birth.
defect?
Yeah, see, so birth defect comes later on when once the semen and the egg have formed an embryo or a fetus. At that time, when the during the growth, based upon the genetical makeup or based upon the genes, and also the any what to say, any hazardous stimulus during the growth period or any other issues can lead on to some amount of some nutritional deficiencies or some issues in the space within the womb. All these issues can cause birth defects. So birth defects can occur even if there is a proper normal fertilization between the sperm and the egg. So, regarding the birth defects, we need not talk much because it is out of male infertility. That is the topic today. So, to that question, yes, birth defects can occur later on. Yeah.
Right. So, what are the probable and most common causes of infertility among men, especially in India?
So in India, what we see the causes would be lifestyle. First would be lifestyle. When a person nowadays, most of us do sit in a desk job. So most of us do not have a regular exercise. What happens is, and our lifestyle food also we are more westernized, and then we do eat a lot of outside food. So the thing is, at that point of time, what happens is obesity is on the rise, and there is also issues in the hormonal balance because of all these issues. And also generally we are used to a lot of environmental changes are there nowadays. We do use a lot of cell phones. That radiation can cause infertility, and also we do keep our cell phones nearby our private parts. What happens is the radiation can affect the testis and lead on to infertility. And also lifestyle habits like smoking and chain smoking, drinking, and recreation drugs also do affect our infertility. So other this is an all acquired due to lifestyle. Sometimes infertility can run in families. It can be hereditary, or it can be due to genetic disorders like microdeletions, etc. So these are the common causes of infertility nowadays.
So, how is male infertility diagnosed?
So male infertility is diagnosed, say, as you said, the couple comes after 1 year of having after their marriage and having proper sexual intercourse for 1 year, so without any contraception. So at that time, if after 1 year they are not having conceiving, then both the male and the female partner would be evaluated the female partner would be evaluated by a gynecologist, whereas the male partner would be evaluated by an andrologist like me. So what we do is, I would talk about the male part. So what happens is we would evaluate a general checkup. We will do the general blood workup. We would do the kidney function test, liver function test, and then we would importantly check for diabetes, hypertension, any other disorders. We would check whether he has any other issues in the whether he has any hereditary diseases running in the family, whether there is history of infertility in the family, whether he had history of mumps. Mumps is a type of viral disease that occurs in childhood that can affect the testis and lead on to decreased sperm count, or whether he had any testicular infection in childhood or recurrent testicular infections that also can reduce, or whether he had any history of any blood cancers in the past which led on to radiation therapy in the past, which can lead on to infertility, and also whether he had taken any medications which can cause infertility. And also, so this is the general history, and we would examine the patient whether he has any physical defects that can lead on to infertility, like small testes or his genitals, or there's some physical issues there. We would check all that and then proceed on to investigations.
Right. So, adding to this, can any major operative procedures lead to infertility, like some heart surgeries or serious, a person met
Yeah.
with a serious accident and undergone multiple surgeries? Can that lead to infertility?
Yeah. See, generally, previous history of major surgeries are there. Importantly, if there is any surgery involving the testis, scrotum, or is there a history of any, they have removed the testis, one of the testis before, it can be due to accident or trauma, or it can be due to any testicular torsion or infection of the testis that required removing of the testis. That can cause infertility in the future, because his total production of the semen would be decreased, because the total number of available seminiferous tubules are less. And also, previous surgeries for involving the spine can lead on to sexual dysfunction that can hamper the fertility of the couple also, because that can hamper the ability of that male to have sexual intercourse. Yeah.
Right. If a person is otherwise healthy, he is not having any kind of terminal disease, but
Yeah.
still he has for infertility. So, what can be the reason behind such cases?
See, commonly whatever we face is not due to terminal diseases, but it is mostly due to lifestyle, hormonal, hormonal. It's like, or genetic. These are the most common issues that we face. So mostly this in this generation, most of the IT professionals who have a desk job, they do face it does increase incidence of infertility in these people. So yeah, so this would be the most common, and the less common would be due to terminal disease and other issues.
Okay.
Yeah.
So these
So
days we see that stress is the main reason, or stress is one of the reasons of any diseases that we face, ranging from common cold to any severe diseases. So how stress can lead to infertility? Because that is, I guess, the mental state. So how it affects physically?
yeah, so stress would is a main issue nowadays, because most of the jobs are competitive, and they have to be
Meet the
stress reduced.
targets.
Yeah, yeah, correct, correct. Target oriented. So what happens is they would work late hours, long hours. So during that time, what happens is their sleep gets disturbed. Because of that, their circadian internal body clock gets altered. What happens is a prolonged exposure to erratic sleep patterns can cause lead on to hormonal imbalances. Hormonal imbalance can lead on to infertility, because the entire total fertility access is dependent upon the hormones. There's a see entire body cycle. There is a hormone secretion is most during the early mornings, then
Hmm.
slowly wanes down. That is the normal body cycle. So when you are sleeping erratically or you're in night shift, long hours, what happens is this cycle gets disturbed. And because of this, the important male hormones get secreted in an odd manner that can lead on to infertility. So this is one of the reasons why stress is a very bad thing for fertility of a male.
So, what are the treatments option available for treating infertility?
Yeah. So basically, when a couple comes to us with the infertility, the male, as I said, I would ask the history. I would properly examine him and rule out what are the physical any issues are there, any past history of significant history is there, which is causing the infertility. And then we would go on with the blood test. We would do a complete blood count, liver function, RFT, and all those things. And then if we'll come on to the specific tests. So specific test would be a semen count, because normally for every infertility event, the first test we ask is for a semen analysis. So we'll check the count of the sperm in that. We would check the motility. We would check the morphology. Morphology is the how it looks, whether it looks normal or not, and several other parameters along with it, the pH, and whether it's alkaline, and the volume, how much semen is he producing, is there any obstruction in the way along the pathway of the sperm. So all these things we will check, and if needed, if examining wise we find the testis to be small or there is some swelling in the region of the testis, we do ask for a ultrasound of the scrotum and the testis with a Doppler to rule out common conditions like this varicocele, which can lead on to infertility.
Right.
Yeah, and also hormonal tests. If we feel the patient is having some hormonal issue, like patient is very obese, he's having other telltale signs of low hormone imbalance and other things, we would ask for a testosterone, prolactin, LH, and FSH, and a hormone panel to rule out any hormone imbalance in the body. Yeah.
Can for infertility be multifactorial? I mean, can infertility be affected by not just one factor, but
Yeah.
multiple reasons that should be treated?
Yeah, so its multiple reasons are always there generally. So the first would be we give a lifestyle modification for the patient. Say a person has a low sperm count. The first thing I would like to tell is most of the low sperm count do respond to lifestyle modification and 2 months of multi-nutrient therapy. For we give some multi-nutrient micronutrient tablets, capsules that they have to take regularly for 2 months. So usually this lifestyle modification with this therapy generally reverts on most of the patients with a mild to moderate low sperm count. So that is the good part about this. And then this says that one is nutrition is important, the lifestyle, sleep, and then decreasing the stress, and then most importantly avoiding keeping electronic gadgets near the scrotum, because to avoid radiation. The second part is the laptops over the lap. What happens is the area around the scrotum becomes very hot. The what it raises the scrotal temperature, which leads on to decrease in sperm production. So that also they have to avoid. And then a healthy diet with a lot of greens and vegetables, fruits would help providing antioxidants and improving the semen parameters. This is for mild to moderate low sperm count. Yeah.
These are some of the very common practices that goes
Yeah.
unnoticed while performing any day-to-day job or any day-to-day activities. But these are really good things to take care of, and of course, food, exercise, and stress management plays a major role these days while in treatment of every diseases. But my next question is, how and when should a patient seek help in this matter? Because in society today also infertility is seen as a taboo or a bad thing. People don't like to talk more about it. They feel shy or they don't have proper guidance. So how
Yeah.
and when a patient should seek help?
Yeah, this is a very common problem that we face in India
Hmm.
because males feel that they are the breadwinner, they are the macho person in the family, and they won't accept their infertility, so they won't come forward for treatment. So
Yes.
slowly the times are changing, awareness is there, so the programs like this will help them to improve the awareness and come forward. But it is a general problem in our society. So the problem is I am getting patients after they come after 8 years of marriage without getting treated. So at that point, what happens is if they are very old, then naturally the improvement with treatment would be, and the options for treatment would be very less.
Of course.
So what I would advise is if they have a doubt after 1 year of proper without contraception, if they are not conceiving, then it is a high time that they come to a andrologist or a fertility expert to have them consulted and get treated.
Right. There are many myths or misconceptions circulating in our society regarding infertility, conceiving a child, or seeking medical help. So, what are those common myths that you encounter in day to day life while meeting patients, treating them?
Yeah, the first common myth is why whenever infertility occurs, it is due to the female partner. That is the most common myth that we face in our society. So what happens is they come, they go to the gynecologist straight away, and then they expect the wife to get investigated and treated, but they won't come forward. The male won't come forward for treatment. So that is the common scenario that we face. But the newer generation people are more positive and more coming forward than the previous generation. But yeah, so when that is the most common myth. So whatever infertility occurs, it is due to the female side. That is the most common myth. And the second common myth is they will say that I will take all those, I'll just eat well, and then do exercise, gym, and then I would have a baby. So that is another thing. So infertility is a very vast disease. So we don't know, each person has a different kind of infertility. It might not be the same for one person and the other person. Some persons would, the lifestyle might do the trick and they might conceive. The other person might have something wrong with the genes, or some obstruction or block in the semen passage. So that can be causing the infertility. That would require surgery. So all infertility people feel that it is the same and that can just medicines would treat it. So that is not. These two are the most common myths that come across. Yeah.
So, infertility in women and infertility in men. What's the major difference in treating both of these infertility?
Yeah. So when it comes to infertility in general, it is the couple has to be treated. So there's no separate male and female. So it has to be done at the same. See, when the wife is being evaluated, the husband also has to be evaluated side by side. So if wife doesn't have any issues and the husband is alone as having issues, even then, if the husband, we are collecting sperm from the husband, the wife has to be stimulated accordingly to, if they are going in for assisted reproductive techniques, the wife also has to be stimulated to produce the egg during that time. So it is, so as a whole, if it is infertility, the both the male and the female has to be treated at the same time. Yeah.
Right. Okay. So,
But the
previous.
difference is, Yeah, difference, main difference would be the set of diseases would be different for a female. So it is low egg count, polycystic ovarian disease, those type of diseases there. Here it would be small testis not genetic disorders, and low sperm count and absent sperm count would be in the male. Yeah.
Right. So previously you said proper food, proper lifestyle, proper sleep cycle, everything matters in overall health actually. So
Yeah.
let's talk about food. Which food helps in treating infertility or preventing infertility? What kind of food habits should be taken care of?
Yeah. So most importantly, you can avoid junk food. So especially high calorie food with a lot of oil, and then uh, processed foods, especially with preservatives. Preservatives can cause a lot of issues with fertility, and also another thing is a lot of dairy products also can cause because some dairy products can have some hormonal things included, so that also can cause to infertility. And nowadays, many people are taking supplements. So supplements, natural supplements, or be it medical supplements, it should be taken usually after a doctor's prescription. So many people get supplements online through Amazon, Flipkart, and all those things, and they consume them without knowing that some of the supplements might contain some hormones within them that can lead on to hormone imbalance within their body, that can future lead on to infertility.
Right. Uh, Adding to this, are there any do's or don'ts in respect to exercise for infertility treatment or preventing that?
Yeah, general normal jogging, running, swimming are all good, but long distance marathons or heavy workouts should be avoided when you're being treated for infertility. So, long marathons and then heavy exercise more than 1.5 hours all can affect your fertility.
Okay.
Regular
So,
exercise is fine, it has to be done. If you are not fit, regular exercise routine is good for fertility.
so keeping our routine, overall routine healthy, having good food, good sleep, and keeping ourselves active, I guess that is the key thing to do for treatment of any major or minor diseases, including infertility also. Right.
Correct.
Okay. So, in today's busy life, till which age one can have healthy sperm count?
Yeah, so generally, what according to several studies, what including male and female, so what happens is the fertility rates go down after 30 years of age, generally.
Hmm.
Okay. So as you grow old, maybe if you cross 40s, naturally the reserves for the females come down drastically. And for males, it will reduce the production of sperm, but it depends upon the general health of the patient. So generally, males are like females. The reproductive age is around the fourth decade. After that, they become postmenopausal and all those things. So for a female, the age group once they cross 30, it is a major issue. For males, generally, for them also, for males also, after 30, the sperm production and the counts do decrease. But males are better off than females. They do have a more extended period of reproductive age. Yeah. So yeah. Generally, we would say the before 30 is a good thing, but recent days, the lifestyle and the total socio-economic thing going on. So generally, people do get married after their 30s. So better late than yeah. That's what I would say.
So, till which age a couple should visit doctor regarding infertility?
No, there's no age. So age meaning, if even if you're married for more than 1 year and you're having unproductive sexual intercourse without contraceptives and you're not conceiving, then that is the instance that you have to come to a fertility expert. Yeah.
Uh, we commonly see that many people are fond of over the counter medicines, and
Yeah.
they usually take over the counter medicines frequently without general knowledge or without consulting a doctor. How is that harmful, or how is that effective in male fertility or prevalence of male fertility?
Yeah, so over-the-counter medications have gone on the rise because of the online platforms. People do get some supplements without a prescription. So, and then some medications they do get at the local OTC or in the pharmacies nearby. So the best advice would be avoid over-the-counter medications for any purpose. So emergency maybe a paracetamol, that is and all is fine, but generally over-the-counter medication should be avoided, and especially taking supplements or any other thing that, telling that they will boost your vitality, everything. So that and all can, if you are taking without a doctor's prescription, that can lead on to serious fertility and health issues in the future. So better not take over-the-counter medications. Yeah.
We always say that prevention is better than cure. So, regarding to male infertility, what are
Yeah.
your views in prevention? What can we do? What shouldn't be done?
Yeah, so prevention would be, say, first would be, the basically this infertility. Most of the times, it is a lifestyle disease. So it is a non-communicable disease. So what we say is first thing would be become more active, at least 45 minutes to 1 hour of daily regular exercise. It need not be very heavy exercise. It can be a light jogging, swimming, or whatever you like. A small session of sports also is fine. And then a good amount of water intake daily, a good green leafy vegetables, fruits, and a proper diet according to your lifestyle would be the best. And then avoid smoking at any cost. Also reduce your alcohol consumption. Occasional would be okay. And then the thing is, occasional meaning maybe once in a maybe a year, everything is fine. At the end of the day, alcohol is also considered as a toxin to the body. And then the third thing would be at no point avoid usage of drugs, recreational drugs. Everything should be completely avoided. Smoking is the major killer of fertility in India, so that should be avoided at any cost.
Right.
Yeah.
So, my
Okay.
next question was related to smoking and drinking.
Yeah.
How that affects infertility, especially smoking.
Yeah, smoking is a general health hazard. So, a lot of toxins and free radicals are there in the smoke. So, cigarette smoke, be it any smoke. So, that affects the germ cells, that is called as the sperm producing cells, and it causes death of these cells. So, naturally, what happens is these toxins accumulate and decrease, they cause death of these cells, and naturally, the production of sperm decreases, so which leads on to infertility. Sometimes what happens is this cigarette smoking and these lifestyle diseases, alcohol consumption can lead on to diabetes and other issues that can affect the blood supply to the testes and can also cause issues. Yeah.
Right. Okay, we have some questions from our viewers also. Palkesh
Yeah.
Mehra,
Can
how does age affect infertility?
sorry, age.
Yes, Palkesh Mehra is asking, how does age affect infertility?
There's another important thing that we didn't discuss, surgeries for infertility. So
Yes.
that we will talk about it. I'll just answer this question.
Yes.
So, what age is the
How does age affect
yeah,
fertility?
Actually, we had talked about it in few questions back. So
Yes.
yeah, so age does affect infertility. So fertility. So any person, male or female, crossing the age of 30, the fertility rates generally drop. So generally, the if it is less than 30, fertility reproduction rate is really good. So once you cross 30s, and especially once you cross your 35 age, the egg reserves in the female drastically drop, and in the males also generally the sperm production is not like they had 1 decade previously. So yeah, generally what we would advise is around 30 better to have complete your family within those, yeah,
Right. One more
age.
question is from Ajit Singh. He's asking, can infections cause male infertility and how does infection cause that infertility?
Yeah, definitely. Infections do cause. Most importantly, infections of the testis. It is called epididymoarthritis. So that do frequently cause infertility, and also mumps in childhood, which is a viral disease that affects the salivary glands. If they have mumps, they can have orchitis, infection of the testis as well. That can reduce the sperm count drastically. So these infections do lead on to infertility commonly. Yeah.
Right. Okay. This was a very informative session with you, Dr. Krishna. Viewers
Yeah.
also, Dr. B. Krishna Menon, I would like to add into his introduction. He is M.C.H. in Urology. He is Chief Consultant Urologist, Andrologist, and Men's Health Specialist, and he is currently practicing at PSG Hospital, Peelamedu, Coimbatore. And thank you, Doctor, for your valuable time. And it has been really an informative session for all our viewers. And we really look forward for many such sessions in coming time. And thank you for your valuable time in this YouTube live session.
Yeah. Bye. Have a good night. Bye.
And thank you, viewers, for an excellent participation. I hope this session is useful to you. And we will be back with some more expert talk and some more expert topics. And for more information and updates, stay connected on our Facebook page, Prostate Wellbeing. We are also available on YouTube, Instagram. Thank you for today. I say goodbye. And thank you.